Here at the White House, my new Ebola response coordinator is working to ensure a seamless response across the federal government. And we've been examining the protocols for protecting our brave healthcare workers. And, guided by the science, we'll continue to work with state and local officials to take the necessary steps to ensure the safety and health of the American people.
If you get the feeling the Centers for Disease Control and the White House are making up their Ebola guidelines as we go along, instead of being proactive well before the current flare-up occurs, join the ever-growing club ranks. And a certain governor spits out, it's all about protecting his citizens, the feds and others be damned. So let the house call begin. Let's welcome back to MidPoint Newsmax Deputy Health Editor Nick Tate joins us here in the studio. Good to see we're all healthy, at least at this point.
So far.
It is fair to say, though, this all seems to be stunningly reactive in so many ways. But let's talk first here about these new CDC guidelines with these 4 different ways to note people now who come in. Do they really make any sense at all?
Well, in fact, they seem to be pretty sensible to me. They're kind of common sense. If you've had
But common sense,
yes.
Not as if it took a long time to figure it out.
Common sense is uncommon in many circles these days. With Ebola, what they're doing is they're basically saying if you have had exposure to a patient, if you're a doctor or a healthcare provider, had exposure to an Ebola patient, then you should be not taking mass transit, you should avoid public gatherings, and you should be on a kind of self-quarantine for 21 days. And then everybody else that follows, who may be in a household with a healthcare worker or may have had secondary exposures, are on a case-by-case basis. The big picture, though, here is this is another incremental tweak of the guidelines. And what seems to be happening is that the CDC and the White House are really they're reacting to news. First we heard Ebola will be controlled by any hospital in America can control it. Well, we found out in Dallas that wasn't true. Then we heard the precautions that healthcare workers and doctors can take, wearing the moon suits, et cetera, will protect them. Well, we found that not to be true. And then we found that in the latest case with Dr. Craig Spencer in New York, well, people who come back who may be not feeling well or just not going to get on mass transit or go bowling or wherever, that proved not to be true too. And I do think that this is partly driven by the fact that the governors of New Jersey and New York both said we're going to require mandatory quarantines. We're going to stop following the path of the federal government, which has been reactionary
and I tend to think
not proactive.
So many others do as well. That Chris Christie has said it right. My job is to the people of New Jersey. My job is not to worry about one individual coming in or what the federal government does right now.
That's right.
They can call it politics all they want, but if something happens and someone comes into New Jersey, Ebola gets out, the first thing they're going to do is Chris Christie did absolutely nothing. So isn't he, in essence, right in what he's doing?
I think he is right. And I think that what that reflects is he at least has the perspective that we want to move to prevention. An ounce of prevention is worth a pound of cure. It's a cliche, but it's also true. And I'm still not sure that the CDC is anticipating being imaginative and thinking, how do we stay ahead of this virus as opposed to following it? What we hear all the time is we're learning as we go. The science is evolving. Well, fine, if that's really the case, but it seems to me that we know what we should do. And again, we have to talk about a travel ban from West Africa. So many health officials are and so many doctors are. Why are we still not taking that step?
Is there any reason for Americans now to trust that their government, the CDC, the World Health Organization, whatever you want to call it, is doing everything they can to make sure at the local level, the hospitals, the doctors, the individual places themselves that people go for care are prepared to handle something if it walks in their door?
Well, that's the big concern, is that this whole this whole issue, scandal is a strong word, this whole issue raises questions that people already have about whether you can trust your government, whether you can trust health officials. Maybe you need to be thinking twice about what your doctor tells you, and I think when we introduce that kind of skepticism and uncertainty, well, who do you listen to when it comes to your own health? And I think that may be a deeper layer that has yet to play out. And it's not just Ebola, it's any other kind of condition. It's cancer, it's heart disease. And I think that's what I'm hearing doctors say is, look, we should not be eroding the level of belief and support and trust that people have of their doctors. And I worry that may be happening.
Long way to go. We got a lot to do. We got a break coming up. 60 seconds or less here. Let's spin to colon cancer and a new non-invasive test at home. That's brilliant. That may save a lot of lives.
It is. I mean, colon cancer is the second leading cause of cancer death in this country, 52,000 deaths a year. What this does is it improves on the current stool test, which looks for just blood to indicate the presence of a possible tumor. This actually tests for cancer-related DNA. 92% accuracy, and what that does is that tells you whether you should be getting a colonoscopy or not, which many people just don't want to do. So it's a higher degree of accuracy. It's simpler, it's not as icky as the other test, and it's more easy to do in your own home.
But remember, there's an 8% possibility this is not foolproof. You should go get the test.
Nothing is. It's 100%, and the guidelines are every 10 years. If you're at a typical average risk, you need to go for colonoscopy. There are other options you can take too.
There you go.
Pay
All
attention.
right. Breaking back with Nick Tate, where we have evidence that multitaskers are not nearly as smart as they think. Most of them are in our control room right at this moment. And later on this hour, in Telling It Like It Is, laughable fraud from one side seeking to curry favor on the issue of equal pay.